I absolutely believe that lowering hospitalization rates is the single most important thing that home care agencies have to do. Hospitalization rates are really out of sight for both hospitals and home care. If you look at hospitals, nearly 20% of discharged patients are rehospitalized in 30 days, 34% in 90 days. And home care is not that much better. We have 26% of our patients are rehospitalized. That means 1 out of every 4 go back into the hospital. It costs billions of dollars and millions of patients are being rehospitalized. So CMS is really focusing in on that, and they're looking at hospitals, and they're really initiating a carrot and stick approach. On the carrot side, they've initiated 5 major healthcare initiatives, and all initiatives are designed to lower costs, improve quality, and reduce avoidable hospitalization. But here's the trick. If you can't do it, you can't join that. The second part, the stick part for hospitals, is a penalty. If hospitals don't reduce the rates for 3 diagnoses, AMI, pneumonia, and CHF, they're going to be penalized starting October 1st, 2011. Now, what's important about this is hospitals have been losing money for the past 5 years. That penalty is going to be added on top of it. They've got to lower their rates. And really, home care is the answer. At least some agencies are the answer. Rehospitalizations don't come from hospitals. They really come from the community. Home care is 59% of post-acute services. If home care lowers rates, hospitals win, and so do home care agencies that lower those rates. Right now, the top 20% of home care agencies have rates of 19% or lower. And remember, what that basically means is if the national average is 26%, 19% or lower is far below what the national average is. So Fazzi's developed what's called the Safe Side program. And Safe Side really comes from CMS's initiative of wanting services to be safe. It comes from the Briggs study, which we did in 2005 on rehospitalization. It comes from reviewing over 1,000 of our clients. It comes from reviewing 10 years of research and practices, and most importantly, it comes from the Delta study, which is the largest study in the history of home care on best practices for reducing avoidable hospitalization. And we really focused on the top 20% of agencies. So what's the goal of the Safe Side program? Assess agencies, identify the strengths and weaknesses, implement the 4 key core components of the Safe Side, and then add individualized practices that are consistent with the agency. And the final thing is we have a monitor built in there that will really focus on numbers, not percentages, but the number of hospitalizations you have to reduce in order to get lower rates. That program is now being implemented in agencies throughout the country, and you're beginning to see the results.